I want to welcome you to the December Patient Voice, and moderating for us today from the PA program, Shonda Duncan.
Thank you. Good afternoon, everybody. I just wanted to thank the panelists for coming this afternoon and sharing lunch with us. And I just want to thank Dr. Foster, Davina Spotted Elk, Nathan Begay, and Lance Johnson. And the student moderators are going to be answering a few questions. And we're going to go ahead and you're going to speak into that little cup. So there's going to be a cup, so just talk to the cup. All right, so for the, go ahead and start by introducing yourself, and then we'll go ahead and go and start with the first question.
Should have Lance in first.
Welcome.
Hi. Good morning, my name is Raylan Montoya. I am a student here at the University of Utah. I am currently in the Health Education Promotion track in my senior year for community emphasis, and I am a mother of two. I have a 5-year-old and a 6-month-old. So I am Navajo, and I come from the Ashihi, Kiani, Tochitni, and Tashchitni clans. I was raised here in Salt Lake, but my family is from Tuba City, Arizona, but I was born in Gallup, New Mexico.
My name is Lance Johnson. I am a member of the Confederated Tribes of the Goshute Reservation. It is a tribe about an hour south of Wendover, both in Nevada and in Utah. It's on the border there. I am the executive director for the health programs for the Confederated Tribes. We currently have 2 clinics, one on the reservation and one in Salt Lake, on 7th South and 200 East. We see Medicaid patients there. We've opened our clinic up to see all people, not just natives. I received my undergraduate degree here at the University of Utah in Health, Society, and Policy, and I received a Master's of Healthcare Administration at Weber State University. I grew up here in the Salt Lake Valley and am currently living out in West Jordan.
Nathan Begay, Shia Tochan Nishland, Nasani Bashichin, Ado Cluster, Dashanala. Hi, my name is Nathan Begay. I currently work for Huntsman Cancer Institute as a program coordinator for the American Indian program and their special populations department. I'm also finishing up some credits for my master's degree here at the University of Utah in Health Promotion Education Community Track. I'm glad to be here. I'm originally from San Juan County, Blanding area. I was born and raised there and have been living here since undergrad. Thanks.
Chuck Foster and Shieto Kiani Slon Teslani Bashichin Hatagani Nada Trapashi check without the Nenchlo. I introduced myself in the Navajo way in terms of our culture and the clan that I belong to. I belong to the Kiani clan, which is the Towering House clan. And Hatnagani is the walk-around people. That's my dad's clan. And my grandfather and my grandmother is the Tapa, is the Edgewater clan, and Hatnagani is the walk-around people. And basically that's who I identify myself with as far as my clan. I was born and raised in Fort Defiance, which is in Navajo, it's called Tsahotsodat. Nasha, that's where I come from, born and raised there. That's where my umbilical cord is at. Born and raised on the reservation, graduated from a small high school on the reservation, and I had my undergraduate degree at the University of Arizona, my master's degree from University of Arizona, and my doctorate degree from Brigham Young University. I see that we're sitting in a really hot place. We better be careful what we say, right? Yeah. And I'm glad to be here. I serve as the American Indian Education Specialist for the Utah Board of Education. and I've been there for the last 11 years, and before that, I was a principal, high school as well as a middle school principal, and before that, I was a classroom teacher. So I've been around the block a few times in terms of education, and now I see the light at the end of the tunnel, if you know what I'm talking about. So I'm kind of glad of that, and I'm just glad to be here. Yeah.
Yat eche yat ye itchachini shlont lashi bashichin. Arot tlaziltanay dashiche tchapai dashanal atasan shlon kodon hitasata. Do yisi zilitlu holyede yisi nasha. Do kade yat bountiful Utah holyede. Ajit kat shalchin biltashagando shastki. He lang kwen rani yai ba Hansen.
Okay, so just to start off with the questions, we are going to start with the first question, and the first question is, please share your thoughts of a quality healthcare experience and what made it so that it was a great experience.
Okay. My last experience recently was I went to my orthopedic surgeon. He lives up in Park City, and he always comes in with a smile and always asks about me, how I've been doing, and ask what I've been doing with my health, eating habits, just kind of, I guess, roundabout way, asking so he knows that I'm active and doing things. So he just doesn't immediately jump into, saying, well, how's your knee, type thing. But just be really kind of just more concerned, I guess, in a way, about what's happening with me. And then after that, and then we start into talking about how my knee is and blah, 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 those types of things. So it's mainly really a conversation, sincere conversation, not just saying, how are you, and then just blow you off type thing. He always allows me to respond to him and lets me talk and not just hurry on situation. So that's been my positive experience lately. So, next is Tim.
It's really interesting in terms of the question. I'm looking at two worlds, the Western world and the traditional world. And I had a triple bypass surgery 3 years ago. That one day I just went out and did my exercise, and I woke up in the hospital. Now, my PA, well, it was the person who opened me up and did the surgery. He was a white man, and he did some visitation down on the reservation. He kind of asked me some of my background, the things that I did on the reservation, so on and so forth. And so I gave him a little bit of my background. And at that time, we talked about Chinle High School, where I was a principal. He did a lot of hiking in the Chinle area, so we made that connection. And after I guess 2 or 3 visits, he if you will, he gave the baton to a PA. And that PA, we started that conversation. He asked me my nationality, where I was from and born and raised, and he did his internship, I guess it's internship? Yeah, on the reservation. He did it right over the hill from where I was born and raised in Ganado, Arizona. So we had that conversation that came up. Now, as far as the cultural aspects, you have the Western medicine and the traditional medicine. And I told him that when I got out of the hospital, I went back to my traditional ways of healing. So that traditional ways of healing was to go back to the medicine man, back to the reservation. That's a cultural thing that I was raised with. And, they went through ceremonies, 2 or 3, matter of fact, 4 to top it off, because 4 for us, it's a sacred number. And it was an experience where the second day when I was in the hospital, and it was early in the morning, I smell cedar, in the hospital room. And this, I guess, basically I was in my dreams, I guess, because in your dream, you can't smell, you can't see color, you can't taste. That's what the dreams are, But for some reason, I could smell cedar. So I woke up and no cedar around. So I start to think that was a message for me to go back to the reservation, go back to where I have my umbilical cord and where I was born and raised, where I could get back to my ways of healing. So that PA and I, we start talking about that process. Him being on a reservation, he says a lot of his patients, they parallel the 2 medicines together, traditional as well as the Western. And I told him that's where I'm coming from. So he felt a lot more comfortable. I felt a lot more comfortable. So now we can openly talk about those traditions. So I think for me to have a quality education, and I think being a quality education or a quality health is that we have areas, the mental, emotional, the social, and the psychological, and the physical, and the spiritual well-being. That makes a whole person. And as a person on this earth, that's what we're striving to be, a whole person. Sometimes we leave things out. And when we leave things out, we become unbalanced. And for us, me being a Navajo, I go back to my ways to balance myself again. So that PA, we saw eye to eye in terms of where I was coming from, and I understand where he was coming from. And he has this practice, he works for the Intermountain Healthcare, and he says that he's never had an opportunity to go back to the reservation or to have an American Indian as a patient to this far. So that's my quality of education. I got to balance the 2.
Recently, I was able to go with my mom to a appointment she had here with the rheumatologist. My family, in the past year and a half, my brother experienced a really bad bacterial infection, a GI infection, and it triggered a gene to activate that. Basically, we discovered that we are carriers for ankylosing spondyloarthritis, which, if you're familiar with it, pretty predominant amongst American Indian communities, specifically Navajo communities. And so when we set up the appointment to come here and we spoke with the rheumatologist, he was some providers I could see taking this experience with I was going with my mom, so it was her, she was the patient. I was observing her interaction with the provider, the doctor, and it was great experience from what I could tell. He was very knowledgeable of the disorder in regards to its effects in American Indian communities. He was also very capable of communicating with my mom medical jargon that she may not fully understand. Also understanding that we were both American Indian. He was also very culturally humble. He didn't come with implicit bias as a provider. He wasn't assuming things because my mom was talking about back problems because she's experiencing some difficulties with a slip disc in her L4 and L5, and so I've been in appointments with my mom with regards to her back where the provider was a little less kind to her, and because she is overweight, they didn't really. Her experience wasn't great, talking about her back pain. In that regards, the physician was basically telling her she was overweight and that was causing most of the back problem and that she should, lose weight. It was a very negative experience for us. But when we went to this rheumatologist, and he went through my mom's medical history, and then we talked specifically about being diagnosed with ankylospondyloarthritis. I just felt like the experience was a lot better. He was also a person of color, our provider, and spoke to my mom with a great understanding of the disorder and was very culturally humble and came in with an understanding that we were going to have questions and then able to answer questions that he had. So that was a really great healthcare experience that I had recently.
So I don't go to my doctor as much as I should, even though he's right across the hall. So I don't, it's interesting in listening to the stories as far as quality of care. When we look at quality of care, especially on the administration side, we look at health outcomes. So, somebody who has a health problem, how is the quality for that care? What was the outcome when it came to that? And when we listen to patients, we've all talked here, or the majority here have talked about health experiences with providers. And a lot of times I believe that we forget that type of interaction with the patient, because the patient in the end is the one who decides whether it was quality of care or not. We have one provider that works with us that's a general surgeon, and he's wacky. He really is. And he's very direct in when he talks to patients, and some patients don't like that, where some other patients, they like that directness. They like, to be able to say, hey, you know what, you've got to do these steps to fix these health issues. And so I think when it comes to quality of care, it's not just based on health outcomes, it's based on the overall experience that the patient has and understanding what that patient needs, and also being able to adapt to that type of patient, whether they want more of a better bedside manner as far as being more friendly, open, and talking with the patient versus a type of doctor who is very direct. So, quality of care, I believe, goes into a lot of things, not just as far as the health outcomes, but also the overall experience of the patient.
So, quality of care. I feel like I get really good quality of care only because if I have a bad experience, I don't go back. And I'll sit there and I'll listen, but by then I'm closed off based on if somebody stereotypes me or is rude or just isn't very nice. And so I do the same with my kids, but I've noticed that what my doctors have that is important is that they listen. They don't just assume. They listen to me, they listen to what I have to say about my kids, they listen to every part, and then we set up goals together, whether it's for my kids or for me. And so I think that's really important for us. And the other part is acknowledging me as a person, but also as a Native American. We have many things that intertwine, and we have many things that, no, it's not good for your health, but that's what we do traditionally. And so I think for me it's really important that they just acknowledge me as a person. They ask me questions about my background and my culture. That way they can either deviate into a different route, or we can still go with the game plan.
Okay. Thank you, Raylan. I'm going to have you introduce yourself.
Okay. Hello, my name is Elvira Murphy. I'm with the Confederate Tribes of the Goshen Reservation, and I serve as the education director. I'm a former council member, and we also have a Sacred Circle Health Clinic here in Salt Lake City. So I helped in implementing and getting that structured for Native Americans and low-income people. And I was looking at the question, what my thoughts are of quality health care. From a Native perspective, I've lived on the reservation, I've lived in the urban setting, so I've had quality care from both the Indian Health Service and just general practice in the cities I lived in. And so it varies in quality health care. And as a Native, we're more prone to be shy, to be able to say what bothers us, and the quality, we don't complain. If you're under Indian Health Service, you're not going to complain about the quality of health care. You're just appreciative that you do get any kind of services. So even if you do complain, it really doesn't go anywhere because they're not, there's not enough fundings to make quality a major part of the services they provide to you. So I guess we could argue both ways. What Indian Health Services, it is what it is, and in America nationally, we still, our Native people still have to deal with it. But for us as Goshen people, we have a clinic now where our quality of health care has drastically improved. So that is my answer to your question.
Thank you. Yeah.
When I say what I'm going with hers, I have my own insurance, and mainly it's because of the quality of the care of IHS. I get better quality because I'm not under IHS. I'm under my husband's insurance, but my mother does go through IHS, and you see the huge gap between both, and how she's just thankful to be able to stay up on her health and with her doctors and stuff like that. So I agree with her.
Thank you. And could you please share an experience of what made your health experience not so great?
Okay, so let's see, 8 years ago, I had my first pregnancy. So I've actually been pregnant 3 times. I lost my baby half hour after birth due to dysplastic kidneys. And there's certain things that Navajos follow and stuff like that. And one of them is not to get a blood transfusion. One of them is the body is very sacred, death's very sacred. So there's certain steps that we follow, and with this, the doctor told me it was very rare what happened to her. So they wanted to, when she was born, open her up and study what happened to her, which isn't an option in my culture. And my grandma fully said no, my other elders and stuff like that. So I expressed that to our doctor, and he sent us to a specialist just to make sure again. And the specialist is the one that brought up the whole point of opening her up and studying her, and asked if we could sign her over. And I told her specifically, I said, no, it's against my culture. It's something that I can't do, and I believe that it's not what I should do. So as time went by, my OB, he respected my wishes and stuff, but the specialist, however, didn't. And she kept pushing and pushing and pushing. And I was already vulnerable. So I finally had to tell him, no, this is who I am. But it came to a point where we seen her again, and it was the same thing she asked. And so that's what made me realize that if people don't respect me or my wishes, I don't go back anymore. So when the baby came, I went into labor, and I already knew the outcome and everything else. She was supposed to be stillborn. However, when she was born, she was alive. So right there is a miracle for me. And so I got to meet her and stuff, but as I was going through this whole process and I knew what the outcome was, a nurse came up to me and she's like, I just want to tell you, your daughter's not going to live. And I was like, okay, I was like, I know this, I know what's about to happen, just let me be. And she kept telling me, she's like, no, you don't understand, like, and I had to finally just tell her, stop, like, I need her out of here, like, and then that's when somebody else came in and they asked the same thing. Can we, by chance, get you to sign this, and hopefully you guys, we can find out what happened to her. And so I told her, no, like, I had to explain it again. I'm Navajo. This is not what we believe in. This is what we can't have done. And so my little girl came. We spent time with her until she passed. And we waited. I was there for a day or two. And then another doctor came in and asked the same thing. And so from there on in, it's just, that was probably my worst experience ever, was not respecting me as a person, but then not respecting my culture. I know, me being in school, I understand the importance in studying and stuff like that, but this is where my culture comes first. And that's what I'm gonna follow, but it just ended up being horrible over and over and over, and it just kept pushing and pushing. And I was already in a vulnerable state. My husband was also, and I just didn't ever feel like a person in that point. And the first chance they let me go home, I took off, and I didn't go back and stuff like that, so. But I had another child, and he had the same thing. He was born with one kidney though, so he was okay. And they wanted to study him a little bit more, but we had a new caregiver, and they were thankfully very respective, and they followed exactly what I said and stuff like that. And so that's the specialist we stick with now. So, yeah.
So me personally, I haven't really had too many bad healthcare experiences, luckily. My family member, my wife, recently went to the ER and was misdiagnosed and sent home with some medication that she shouldn't have been sent home with, which caused or helped cause a perforated bowel, and she had to go in for an emergency ostomy and had to have a colostomy bag for about 6 months, and then luckily she was able to go in and have it reversed. So, and then again, we had some bad experiences with when we were at the hospital where it happened. We actually ended up transferring up here to the University of Utah because of those experiences with the health caregivers, the nurse, and not following up with us in a timely manner. Luckily, I work in the healthcare field, and so I was able, through the providers that we have there at our clinic, I was able to find out information and give that information to her before the nurses or any of the providers was able to do that. And that was kind of upsetting that I had to call on my own and figure out what was going on. So the misdiagnosis, that can happen to any provider, but then the care after the surgery that happened at that facility was poor care, and again, it was me finding out what was going on.
I haven't had any negative experiences in terms of a poor health care quality recently, but I remember when I was younger, my parents utilized IHS facilities and IHS physicians, and just my experience, I can remember going in for routine dental checkups or just routine physical checkups or anything. It was always a negative experience. The staff at the IHS facilities were never really nice. They were never really, didn't seem like they wanted to be there. The physicians were never native, and they often didn't seem to care a whole lot. And as I got older, I started to do research in quality of care within IHS facilities and listening to other patients' experiences, and it was very similar. Understanding the history surrounding IHS is not something that Native people wanted, nor is it something that we necessarily designed ourselves, but it was something given to us, so then we just had to deal with what was given to us. And also, I think understanding the history of Native people in healthcare in this country is also important. I was not aware of the awful and horrific experiences of decades past of Native people in this country and their experience with healthcare, and understanding that as you go into these exam rooms and you're talking to these patients, that we're coming with a lot of mistrust. A lot of us don't really, if we're not seeing a Native person in your facility, we already don't want to be there. We don't think you're going to treat us right. At least that's my perspective, and that's people whom I've grown up around near the reservation, is our perspective is when we go into a facility off reservation, we don't really see Native people, we already don't expect there to be quality of care. But yeah, my experience going to the IHS facility when I was growing up was not great. The physicians were never nice. They didn't care so much. One that sticks in my mind is when I would go in for dental procedures, there's always this same dental hygienist who I didn't like. She had this ugly perm and ugly glasses. But she would take x-ray photos of my teeth. And if anyone's experienced taking x-rays of your teeth, if you're not gentle with the films in the mouth, that's not a fun experience. She would shove them down my throat and then tell me to bite down and then angle the camera to my jaw and just say, "Stop moving." Like, that was horrible. But she didn't care. She didn't care about me. She just wanted to get her job done and then on to the next patient. And that's something I kind of feel is something that falls in line with poor quality of health, is when you're no longer a patient and you're just a number. Because that's how a lot of IHS facilities work. Their funding is allocated to the patients they see. And so then it's numbers, 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 and not really quality.
Anybody in here pharmacists pushing pharmacy work stuff? Nobody? Nobody wants to admit, huh? I'm going to talk about you guys, hey? You know, that, you know, I think I'm pretty healthy. You know, I try to eat right, sleep, rest, you know, exercise, you know, my diets, you know. But I love that fried bread and stew, though, man. That's some really good stuff. That's what got me into the hospital, I guess. You know, you know, medication-wise, I never had medication given to me or anything like that. Now I'm on a little bit of medication. It's kind of interesting that when I took first time I took that medication, I floated off, if you will. You know, I was floating around, and I thought that was normal. I said, I want some more of that. I think that when they diagnosed and they gave me the medication, it was, you know, I guess they go by the diagnose plus your weight and all that, and how your bodily function goes, and so on and so forth. And I don't think that was anybody's fault. You know, and maybe it was half of mine because I didn't say anything, but I sure loved that state, you know. And I start to play with that. I start to play with the medication in terms of, you know, they give you this large horse pill. So I cut it in half. And it's still doing the same thing to me. So I cut that in half again. It's still a little bit, and I cut that in half, and then that's what I was taking. And today, I'm my own pharmacist. That's what I do. I get that big pill, and I start cutting it. I know exactly what the dosages are. But see, for me, that was, I'm not, you know, it's no blame. It's not being diagnosed. It's not anybody's fault. It's just that something that I don't think that it's you know, maybe it might be the person that prescribed that. Maybe it was his diagnosis and it was mine because I didn't say anything. So I'm just trying to meet a happy medium here. So you know that's the only quality, you know, the quality of the quality of medication, the healthcare. Maybe it was there, but. It's just that now I'm adjusting to that new lifestyle, if you will. So that lifestyle now, it's I have, you know, the medication portion of that. Now I gotta adjust to that. And like I said, now I'm my own pharmacist. I have large pill, and I just cut it in half and know exactly what I need to take and how much to take. So, hopefully one of these days I'll get away from that. I'm not so sure that it will happen soon, though.
Okay, pharmacist. Native American pharmacist for you. No, I'm just kidding. No, my pet peeve really is about time that the doctors, I think we're all in the same boat with this, is that, you go in, you sit there for ages, you might get out of the common area, and then you go in back in the room, and you still wait and wait and wait. And sometimes you just want to walk out and say, okay, my time's more valuable than yours. Or hopefully you can understand that. But I think some of this has a little bit, I've noticed, has taken place that things are a little bit quicker, but not too much. But you do get in situations that you have to wait hours on end, and that is, I know that they have to take down notes and et cetera, but there's computers now and voice things that they can hurry up and record things and such. But that's the thing that I is the most negative experiences that I've ever had, is time consuming. So, anyway, there's been other things, but that's my major pet peeve thing. Okay, now Violet.
I think, I live in Ivapaw, which is 3-hour drive from here, from Salt Lake, and we have IHS, which is in Elko, which is also 3 hours, so we're basically right in the middle. So one of the biggest problems we have on the reservation is being able to go and go to a health facility. And sometimes we won't go because the fact is it's a long drive, and if you just go in for an exam, then they turn around and set up another appointment for you for another date. So in that process of being diagnosed and analyzed, you lose interest. My pain's gone away, I'm not going to deal with it, and so until you're actually at the point where you're in the emergency room. So that is kind of how we deal with it on the reservation, and it's really sad because I've known of quite a few tribal members that have gone to emergency room or wait too late and big diagnosed with cancer at stage 4 and further, so where they're at the point where it's too late. And so that's the sad part, is because of where we're located, the time it takes for anybody to want to go to the doctor, you're going to lose interest. We don't have enough education that will provide us that being proactive in our own health. And that, I think, is important, is educating your community or people in general about their health. And I see in the city that they have a lot of, these are the symptoms for this disease or that, but it's not enough for us. We're isolated. Our only form of the media coming in is through computers, if you're able to have internet or satellite, which is not for everybody. We're very low income out in Ivapaw, so education, as an educator, I've done my assessment of the degree of education in my valley, and it's very low. So to be able to provide education, you have to do it in the most general sense, so people are able to understand why it's important that you become involved in your own health. Myself, I've been very fortunate. My mother was a nurse growing up, so she was always proactive in us seeking health, and we were never shy about saying this is what's wrong with me, and I'm pretty good about keeping my own health history. So when I go in and see a doctor, and under Indian Health Service, you don't ever get the same doctor. You're not privileged to have the same primary health care person, so you're basically having to tell your whole medical history every time you go in. But not every Native American that will do that. They will just go in and say, I hurt here today, and so they're not very vocal about what their health history is. I'm fortunate that I had a mother that made sure that I tell them exactly my history of who I am and what my family history is. And so And that's why as a tribal, as in a leadership or in education, those are the things I do see that we lack on the reservation, is more educating health-wise, understanding why it's important that you're more proactive in your health needs. So.
Great, thank you. And you left off on a good note. So my third question is, how do you think your observation and experiences will help us teach our students about quality health care?
Again, continuing with that conversation, one of the reasons why we pursued as a tribe to reach out and create a clinic was because of those reasons. We wanted a facility that was geared towards Native people and their needs, and traditionally, there's things that do happen. I know my father was, he practiced his Native medicine, and so he had the opportunity a lot of times to go to the university and provide those kind of services, praying for them and providing that kind of medication. And the University of Utah was really great with working with him and allowing him to go into these tribal members' rooms and be able to provide those kind of ceremonies to comfort them. And I, even as myself, the experience was as a dentist, I had a really great dentist. He would say, he says, one thing I noticed about Native people is you've got more nerves in your back molars than another group of people. And so he would always make sure that he gave me enough medication to numb my tooth versus another dentist that did not service Native people would not do that, and I would always be in pain. I would have to get more shots, and they would just give me so many, where my dentist was in tune with who I was, and he says, you have more nerves as a Native person. So I understood that, so that was something I would tell other dentists that I would go and see. And so it's interesting. I think to practice working with Native people in general, I think it's understanding the cultural, and as the other gal at the end said, there's certain things we do traditionally that we don't, that we do even in times of emergency care, that we don't allow because of our whatever our culture is and their beliefs. And so I think it's being more sensitive to culturals is important. So.
I just want to say that, just kind of back up what she's already said too, is depending on what area you're going to be involved with, if it's back east or wherever, I would suggest to you to look up some of the Native tribes that you might be possibly serving in those areas and come a little bit more familiar with our cultural side of things. Because definitely there are a lot of natives out there that are still practicing our culture. Actually, I shouldn't say that. It is every day of our life. Our culture is, whether some people say it's religion, I don't believe it's religion. It's just a part of us, and it's something that we do every day. And I think a lot of people don't understand that. But, yeah, definitely, I would just advise you to kind of look up some of the tribes whom you'll be serving, possibly in the future. And when you do that, obviously, you'll have a bit more of a connection with them. Hopefully, positive things can result as well. And that's all. Here you go.
Thank you.
Pharmacist.
There's four words I use, I think this kind of sets the stage, is empathy. Have empathy for the person, the tribe, the location, whatever. You have a little bit of understanding, the understanding in terms of where you're at and who you are and who you're serving, so on and so forth. You accept, the place that you're at. And oftentimes that, as we accept where we're at, I think you make a little code for yourself in terms of your job site. And the last is, I think it's probably one of the biggest, is the respect. The respect you have for that individual. It might be another culture. So I think that, have empathy, understanding. You have being accepted. You accept it and respect that person. Thank you.
I would just say, understand the history of Native people in the areas in which you choose to work. There are over 562 federally recognized tribes, and there's like plenty more that are not recognized, and we're all different. We have different cultural protocols. So if you're going to choose, if you get placed in an area that has a high density of American Indian patients, understand their culture, understand their language, understand their community. Don't go in as an expert, just go in as like a listener, and also understand the history of those communities and where they're at, understand their interactions historically with medical professionals, because that will definitely help you go in culturally humble and understanding kind of like a little more of their experience. You don't have to understand their experience fully, but just listen to them and observe what they've done and go from there.
No, just want to agree with what everybody said, is understanding what the people you're serving, Native American or non-Native. It's funny when you hear about Native Americans or Indians, you think of Plains Indians with feathers and that type of thing. And when you look at our tribe, we didn't have that type of thing. And we were nomadic. We lived in the desert. We roamed and lived off of the land. Some people said, when my kids would say, yeah, we're Indians, they said, you're not Indian, where's your feather? And that's what they'd always say, where's your headdress? So if you look at educating yourself as far as the people you're serving, Native American culture is vastly different across the United States. You look back east, their culture is very different from the Western Native Americans. And so understanding who you're serving and understanding what their beliefs are. Native Americans, I think, I just said don't generalize all natives, but Native Americans, as you've seen here, they have a very, from what I've seen, the natives that I've come across, they're very spiritual, and they believe in that spirituality. You heard Elvira talk about, her father would come here to the University of Utah and give native blessings to those people who seeked it out. My father does the same thing. My grandfather did the same thing. And so understanding that, and those beliefs run deep. It's not based on science, it's based on how they feel. And so understanding those beliefs and understanding that when you tell a doctor, no, we're not going to do that because it's not my belief, you just infuriate the patient because your science knows more than what their beliefs are. And so that goes across the board for all cultures. Like Elvira said, we have a clinic and we've opened it up to the underserved population here in Salt Lake. And patients are on Medicaid that come to our clinic. And refugee patients, when they first come to the United States for 9 months, are on Medicaid, and they have a hard time here in Salt Lake finding providers, we see them at the clinic, and we see the same cultural issues that the natives face for Iraqi patients, Afghani patients, patients from Somalia. They don't want a male provider in there with a female patient because that's not their culture. And so they will be turned off if you send in a male provider to a female patient. They want a female provider because that is their culture. And so anywhere you serve, whether it's Native American or other cultural people, you have to understand that culture that you're serving.
I think the importance in learning cultural sensitivity, obviously, and acknowledging us as people. And then the other thing, to say with his, obviously all tribes are different. Some people believe this, some people believe this. But then within our tribes also, there's different practices. Like Navajos have the Navajo church. They have the beauty way. There's certain things, and with my background, both of my families practice both. So I kind of have to find a way to intertwine both, but then also Western world society because I live here too. But I think with respecting and understanding Native culture, it would help bring more Natives in. I know that a lot of our elders, as other people have said, is the lack of trust is already there with care providers. And so I know my grandmother, she goes to the doctors, but we have to push her and push her and push her. And she doesn't believe a lot of things that they say. She would rather go to, she would rather not go, so then she doesn't have to have bad experiences. And so I feel like if we as a community could all learn and understand backgrounds and culture, it would bring more Native people in. And it would obviously help our population also. But then it would help you guys also understand and learn more to the point where I don't have to go to 5 doctors to find one that I like. Or somebody, I was in a meeting a couple of weeks ago and somebody said it perfectly. It says, a leader listens. And that's the most important thing I feel like when I go to the doctors, somebody that listens to me. They don't just assume. And so if we could intertwine that with a lot of things, it would help everybody learn about who we are as people, what our beliefs are, what our background is, what our culture is. And then we could build a bridge again with our community and Western society medicine. And I feel like that would help us a lot. And that'll bring a little bit more trust back into this world. So, yeah.
Thank you. Thank you, panelists, for sharing. And just wanted to go out and ask the students or anybody from the crowd if you had any questions.
Yeah. So about this time last year, I was actually in Blanding, Utah, for the Utah Rural Outreach Program here at the medical school. I dissected some cow hearts and lungs and told the kids there about careers in healthcare. And ever since then, I've wondered how effective it was really. So I'm curious to hear all of your perspectives for your own tribes and your own families. What kind of an interest is there in working in Western medicine, and what might be significant obstacles to doing that if a young man or woman chose to do that?
That's a good question. As an educator, one of the things I look for, because we're a very small tribe, is mentors in the health field, because I think it's important that the outreach is not going to be with the older kids that are already towards graduating. I think in order to provide education in any sense, in any field, it has to be at the very beginning. When they're young, you have to start training them to look at the future. I actually did a workshop with the kids at the elementary school, and it was in financial, it's an example of financial literature, and to just go in and work, go in and work with the kids. A lot of our kids, Native kids, didn't understand what savings was, what planning for the future. Just very general things, and it was really sad to realize that those are conversations that are not being provided in the home. So they're not understanding what that concept or those words mean. And so that was kind of what we went off of, was vocabulary and having them understand what those things meant. And that's the same thing in any field in education, or allowing our kids to dream of what they could possibly be. They watch, TV will say, be a graphic designer, be a pro athlete, or those things. But the general things, like in going into science, into medical, into government or whatever, there's really no education for that. And so for me, I'm looking for mentors in regards to that will start coming out and working with our kids and making it fun. We have the STEM programs and things, but because we're so small where I'm located, that it's really hard for me to find the funding resources when my kids, I have a base rate of 28 kids, and that's from heads from early child development all the way to 12th grade. So my base is very small, but to find fundings for 28 kids in each of those groups, I may only have 1 or 2 kids in each of those grade levels. So I'm always looking for opportunities to partner up with another group of Native Americans or another with the education, and Dr. Foster's been great with helping with some of those things. But that's kind of where I'm looking at, mentoring, and to find people that are willing to come out and mentor in health field. And I think it's important we start very young with them.
I used to be in education, and we'd run some conferences over at the Slick College. And we've had some of the University of Utah people come out and do dissecting and such. What we always tell the students is, if you know, depending on how strong they're connected with their culture, sometimes some of them, you would give them a chance to be able to just kind of back off and not be part of it, just watch type thing, just for, for you respecting them for what they know. So I think they would, if they just stand back and observe, I would imagine they would understand what you're trying to teach them. But mainly, the baseline, I guess it is just to give them a chance to do what they've been taught at home. It's what I think you're trying to ask. Is that right? So, okay, maybe the pharmacist can explain that.
Don't take the medication I'm taking then. That's all I can say. To get back to your point, I think they start early on in grade school, 5th, 6th, 7th grade. You get to, you get into high school, it's kind of a little bit too late. One example I can give personally was my granddaughter. Now she's a pre-nursing person at Utah State University. She started out in 5th and 6th grade. It was people like that, the uniforms that they use, and some of the people that came down to visit their school. And that really entertained that thought in terms of what she really wanted to be, and that stimulated even more when she got into high school, because now she had an opportunity to go and do it's not internship, it's you go to the hospital and work with those, I don't know what they're called. You go to the shadowing, stuff like that. So I think, again, you start early on, and that early on stuff really works, so.
Oh, do we have more time, or is that it?
Yeah.
I have a question. It sounds like, and I grew up next to an Indian reservation in Wyoming, Wind River Indian Reservation, which is Shoshone and Arapaho tribes, which are completely different in culture, but they live in the same area. So, but what I understand from the Native culture is that there's a basic distrust of white people. And so I'm wondering, my question is are you receptive to people coming to your community for health education, or, those kind of things? Is that received well, or is it received with some level of skepticism just based on culture?
Well, if you're consistent coming out, that shows them, okay, you can trust them.
So if you do it repeatedly.
But if you just come and just disappear, just like you'd be like, okay, person's not really that interested, but if you're consistent in doing those things, yes, they'll see your sincerity.
So if you become part of the community.
Yeah, they'll
essentially
that.
So, I think the important part is also when you're doing it, you have to remember that we've been used and abused. Let's do a needs assessment on these people, and then let's do this little program, and then we never hear from anybody. And I think it's just put a lot of that mistrust in. But the other part is you can't just come in and say, okay, here's, sit in front of a classroom and lecture everybody about everything, because that doesn't work with Native people. With Native people, a lot of it is community learning and community building. So right now I'm in the midst of developing a program, and I have 3 other group members that are white, and they're learning how to do this. And so I said, okay, you know what, there's this this event going on, this event, this event, this event. And I've actually started bringing them around with me, because you have to build trust within the community before you try to implement something. And they're going to be more, building that trust, they're going to listen more, they're going to open up a little bit more, they're going to trust a little bit more. And so the other part is realizing, yes, this is your program and you're putting it on, you're the leader, but in Native culture, everybody is the leader. You switch places with your person. So I also do American Indian education with Murray High School. And with the kids, we come in and we come together, but when we tutor, it's not just, hey, you know what, this is a math problem, do it. This is how you do it. No, we learn together. So sometimes they're my teacher and they're like, no, this is how we do it. And then there's sometimes where, okay, well, this is how I've learned it. We all learn together. It's not just one person doing it by themselves. So we have a big table and there's 5 of us and everybody does it together. And that's the most important part. And then being consistent also is, once you're done, don't just push us off to the side. And I think that's where a lot of the problems have come with successful programs on the reservation, is when you're done, people just leave. But you could bring in more people to keep it going, and that would help a lot with the community.
So I know we're past time, but I wanted to thank all of you for your interest in